Hello, everybody. Just give me a few minutes to make sure I have all the platforms on and we will start. Okay. Great. I think we are live everywhere. So hello and welcome back to our yearly back to school series for parents on Generation Z, sponsored by Jacob's Ladder Therapies. For those of you who are new to us, Jacob's Ladder Therapy specializes in individual, family therapy for teens, tweens, and young adults and parents suffering with anxiety, depression, mood, and personality disorders, trauma, and family issues, including marital distress, communication problems, separation, divorce, life transitions, and addiction. Our services are finally back in person at our office in the San Jose Los Gatos area, and we also deliver services via telehealth video sessions, and newly we offer walk and talk sessions in the North, South, and East Bay. I will talk more in this presentation about what walk and talk sessions are. We do have a diverse group of licensed clinicians and are able to deliver services in English, Spanish, and Mandarin. And you can view all of our clinicians and their bios on our website, which I will put in the chat box for everybody. We are extremely passionate about providing free informative sessions to the community at large. And this evening, I will talk to you about what therapy is and how you can pay for it. I am a licensed clinical social worker with over 15 years of experience working with teens and parents. I have worked in child protective services, foster care, group homes, hospital, and also in private practice. I currently work as a clinician in an intensive outpatient program for teens and young adults, and I am the owner of Jacob's Ladder Therapies. I started the program for teens and young adults to provide one-on-one and group therapy and parents, and it's grown to also service transitional age youth, adults, couples, and families. As a reminder, this session is strictly informative and should not take the place of therapeutic services by a licensed professional. If you or your family member is experiencing a medical or psychiatric emergency, please call 911 or go to your nearest emergency room. If you feel your family member or you could benefit from therapeutic services, please contact us right away. We do provide free assessments to help determine the right level of care for you and your child, even if it's not with us. And I'm going to put the link to self-schedule and assessment in the comment section. There we go. So I am delighted to have an audience of parents and caregivers joining us via Zoom, Facebook, and YouTube. As this is your chance to ask an expert, please post your questions in the comment section and I will address them at the end of the presentation. If I catch them in between, I will address them then as well. If you miss any parts of this or want to recap, you can view it in our Jacob's Ladder Facebook page or YouTube page, and I will post those links in the chat box as well. And this is our YouTube. For those of you who are on Facebook right now, I will post the links at the end. Okay, so let's get started. I'm going to share my screen. Okay, so therapy and money explained. Does my teen need therapy? So I'm hoping in this session I can address the types of treatment that are available, including outpatient, inpatient, and everything in between. Where to find a good clinician, what is telemental health, issues of consent and confidentiality, and how can I pay for therapy, i.e. will my insurance cover it? First things first, how do I know if my teen needs therapy? So last week, Sunny gave a fantastic presentation on depression and anxiety, suicidal ideation, and self-harm. And those are some of the things that we look for when we think about does a teen need therapy? So I just wanted to recap some things to look for. If your teen expresses any suicidal ideation, that means they say they want to kill themselves. They say things like, I don't want to be here. I'm not sure I want to live. If they express any sort of suicidal ideation, if they say that they've had a suicide attempt, those are things, that's one thing for sure you definitely want to get treatment for. If they self-harm, a lot of parents will dismiss self-harm as just a form of, expression, or they're not really doing it to kill themselves. It makes them feel better. The correlation between self-harm and suicide is very strong. So if you do have a teen who's self-harming, that is an indication that you definitely need to get them some treatment. If your child is the victim or witness of abuse, that is also an indication that they need to get some treatment. And that's they've ever experienced any of that. If they are experiencing for the past 2 weeks, irritability, mood swings, change of sleep and diet, either they're eating more or eating less, sleeping more, sleeping less, if they're feeling hopeless or helplessness, they say they feel worthless. If they have a loss of motivation in the things that they used to like to do, sometimes we call that being lazy. But if it's going on for more than 2 weeks, it might just be more than just being lazy. And if they say they have an inability to feel emotions, or they say the word numb, numb is a very key word that we look for because numb is actually more significant than feeling depressed or feeling sad. Numb means they're not feeling anything. That's well past feeling sad. So if they're having any of those symptoms within 2 weeks, then definitely want to get them treatment. If they have poor concentration, having physical complaints like headaches or chest pain, if they do have headaches or chest pain, the first thing, of course, you want to do is take them to the doctor. Chest pain is very significant. You probably want to go to urgent care or the ER for that. But you want to rule out anything organic, so anything physically going on. But if you've already taken them to the doctor and there's no physical reason why they're having headaches or chest pain and it's been going on for 3 months, you want to try to get them some help. If they're getting easily overwhelmed, if they're getting restless, like nail biting or shaking their legs, if they're having ruminations or loss of energy, or just feel like they can't problem solve, and that's going on for 3 months or longer, then that's an indication that they need therapy. So that's just a little bit of a recap on how you know, like, okay, now I know that my teen needs to get some treatment. So what can therapy help with? So therapy helps with mood disorders, personality disorders, psychotic disorders, eating disorders, addiction, identity disorders, and trauma. So mood disorders include like major depressive disorder, anxiety, PTSD, bipolar. Personality disorders include borderline personality disorder, narcissistic personality disorder, antisocial personality disorder. Just as a caveat, teens cannot be diagnosed with a psychotic disorder before age 18. However, they can start to show traits of personality disorders, and there are a battery of tests that a therapist can give them to see if they're starting to go in that direction. The reason why we don't diagnose teens with psychotic disorders or personality disorders is because their brain is still growing. So there's always an opportunity to try to change the trajectory. But we do certainly see traits, especially with borderline personality disorder in teens. And we try to use different skills and different methods of treatment in order to help them so it doesn't become a major issue when they're an adult. Psychotic disorders are things like schizophrenia. Eating disorders, we're talking about like bulimia or anorexia. Bulimia is when teens may be binging and purging, as in they're eating a lot of food and then making themselves throw up, or one or the other. Anorexia also includes being underweight. And then addiction, we're talking about drugs, we're talking about alcohol, sex, pornography, games, internet. There's so many different addictions that a teen could be experiencing. identity disorders, and we're talking about sexual orientation or gender identity disorder. Not just that they're they're trying to figure out their sexual identity, or they're trying to change their gender, but this is when they're really struggling, and it's gone from I think that I may be a different gender to where it's causing problems in terms of their functioning. And then trauma. Trauma can be anything to being a victim or a witness to a crime, abuse, removal from a home or parent, homelessness, incarceration of a close relative or a parent, major medical issue, whether that's them or a family member, death or loss of a loved one, or even a pet, or in case of a global pandemic. And so we are certainly living trauma right now. So those are some of the things in which we treat when we say, when we're thinking about, getting a teen help for therapy. So there's different levels of care, and we'll start with outpatient. Outpatient level of care basically just means that the teen goes to a place to get treatment and then they come home. So there's your traditional one-on-one therapy where they would meet with a therapist, and we'll talk about the different places and how they could meet with a therapist. But basically it's the teen and the therapist one-on-one. There's also group therapy. Group therapy is where they're with their group with other teens, either experiencing the same symptoms as them. Sometimes they're grouped by age. It really just depends. The power of group therapy is sometimes underestimated. Groups, especially in teens, tend to be very supportive of each other. And when it's facilitated correctly, can actually be just as strong, if not stronger, than one-on-one therapy. So then you also have what's called IOP. So that's intensive outpatient. Intensive outpatient is basically therapy for 3 hours a day for 3 to 5 days a week. And these are teens who maybe have really strong suicidal ideations, who may self-harm, or who may have addiction problems. But this is are the teens that need more than sort of your regular one-on-one therapy. They need a little bit more treatment. And typically an IOP program would last anywhere from 8 to 10 weeks. And then they could step down to seeing a one-on-one therapist. And then there's also what's called PHP, and it's partial hospitalization. And basically partial hospitalization is at least 6 hours a day of therapy, and it's 4 to 5 days a week. And it typically lasts anywhere between 2 to 5 weeks. So it's a little bit more therapy than IOP. In a PHP program, you would typically also have schooling involved in that. So your team would not be going to their traditional school, they would be going to school at the program. So they would likely take a leave of absence from their school or medical leave of absence, and they would be doing some sort of schooling at the program, whether it's their own school sending work home, or that PHP program has an actual school integrated with their program. And then there's what's called dual diagnosis. So dual diagnosis is when you're treating a mental health disorder and a co-occurring disorder. For instance, like an eating disorder or a substance use. So when there is a substance use problem or any sort of addiction, and there's a mental health issue, the way that you would typically treat it is you would treat the addiction first, and then you would treat the mental health issue. And the reason why you would do that is because you can't really teach teens skills on how to deal with their mental health if their fallback is always going to be on the addiction. So you'd want to treat the addiction first. In a dual diagnosis program, you get the benefit of treating both at the same time. And dual diagnosis could be a regular group, it could be IOP, it could be PHP level of care. But dual diagnosis is typically when you have a mental health disorder and an addiction, and you're treating them both together. And then you have what's called wraparound services. So wraparound services are basically when the entire family gets treatment. So you would typically have an overall therapist that's looking at the entire family. Then you have a therapist that works with the teen. You have a therapist that works with the parent. And so the entire team kind of comes together and wraps the family. So those services are typically pre-COVID, they were delivered in the home. So they'd be delivered in the home, in the school. The therapist would actually come out to the school if there was an issue and sit with the kid all day at school if they needed to. The parent, they may have to go to the parent's job, whatever it was that family needed to try to stay together. That's what wraparound services does. What are the services that need to be in place to keep this family a unit? Now, wraparound services is not available to everyone. Wraparound services is typically only available when you either have Medi-Cal or you have had interactions with Child Protective Services and that child is in danger of being displaced from the home, or they've been taken from the home and now they're back in the home and they're doing wraparound services in order to keep that child in the home. So wraparound services is not available to everyone. But what I do tell parents when they have, so, you know, therapists are mandated reporters. And when things happen and the therapist has to make a CPS report, families get very, very scared. And what I tell families is, this actually might be a good thing for you because this is the one way that you might actually get full service treatment. Child Protective Services is not there to take away your kid. Child Protective Services is to see how we can keep your kid in the home. And WRAP services is one of the services that's actually only available if you have Medi-Cal or if you've been in the foster care or the Child Protective Service system. And then now we can talk about inpatient. So inpatient basically just means that the teen stays at that place. They don't go home and back and forth at nighttime. So inpatient includes the hospital. So teens can get placed on what's called a 5150 or 5585, and I'll talk a little bit more about that in later on in the presentation. But basically, when they are in danger of, if they're a danger to themselves or danger to others or gravely disabled, most teens are not gravely disabled if they live at home with their parent. So they typically would only get hospitalized if they were an immediate danger to themselves or immediate danger to someone else, then they would go to the hospital. And that's a psychiatric hospital where they would get stabilization. It's not really for, you know, full treatment. It's really just to get them stable so they're no longer a danger to themselves. Then once they're ready to leave the hospital, it's like, okay, what's the next level of care for them? Do they need dual? Do they need PHP? Do they need IOP? Can they go just do one-on-one therapy? There's a whole team of social workers and psychiatrists that help determine the level of care after a child leaves the hospital. A lot of parents ask if they go to the hospital, is it on their permanent record? It's on their hospital record, but it's not necessarily something that a school would know about. And it won't follow them for the rest of their lives. Parents ask, well, if I get placed on a 5150, will my child ever be able to own a gun when they get older? Yes. And we can talk a little bit more about that. But there's many different laws that protect teens. The most important thing is if your child is in danger, please take them to the hospital. If they express that they want to kill themselves, or whether or not they have a plan or not, we just take them to the hospital to get evaluated, and the professionals can decide, do they need a hospital stay, or can they be placed back at home safely? Another inpatient resource is called residential. And residential is typically a stay anywhere between 30 days to, it could be 6 months. And basically a teen would go basically being taken out of the home, and they would stay at a particular place and basically get therapeutic services 24/7. And we would recommend residential when a home environment may be toxic. And it may not be toxic because the parent is toxic. It just means that the teen is not able to function, not able to use skills. Maybe they have a bunch of toxic friends and they need to get out of their environment. And so going to residential may help them get out of their environment and get into a place where they can have 24/7 treatment to get better. Part of the thing when teens go to residential is that the parents also have to do work. And so, because if you take a teen out of their environment and you put them back, they get all this treatment and they go back to the same home environment, you haven't really done anything for them. They just kind of revert back to old behaviors. So part of going to residential is, okay, parents, you get a break. You get to figure out, okay, what do I need to do differently? How can we what things can we put in place that can be different when my child comes back home? And a lot of times they do what's called home contracts to help transition the teen back to home. Then you have what's called wilderness programs. Wilderness programs are actually very popular. Most of them are kind of in the Midwest, where basically teens live out in the wilderness. They live off the land. They live with therapists. They pitch tents. They eat in the wild. And basically they're doing therapy, but they're doing therapy out in nature. Teens who have like ADHD, who are very hyper, used to have a lot of energy, or enjoy like a lot of sports. Wilderness is usually a really great program. Wilderness is typically longer than residential. So you can be in wilderness anywhere from 6 months, sometimes up to 3 years. Teens, when they like it, they typically thrive in wilderness. And so that is an option. And then you also have therapeutic boarding school. So therapeutic boarding school is typically an option when teens are not doing well at home and they're also not doing well at school. And you try to find a different way to get school and mental health at the same time. So there are a lot of therapeutic boarding schools across the country. And basically you would go anywhere from 1 year to 6 years. So they could go all the way from middle school to high school in the same boarding school. That might mean that they stay there the whole time. That may mean they stay there just during the school year. They come back during summers or holidays. It really just depends. Now that we're sort of post-COVID, I know a lot of therapeutic boarding schools are back up and running, but things may look a little different than they did pre-COVID. So again, the hospital, residential, wilderness, therapeutic boarding school. Service delivery locations. So the typical way of delivering services is that you would go to see a therapist in an office or a clinic. Some therapeutic services used to be delivered at home. So therapists would come into the home. Wraparound services would be delivered at home. Post-COVID, that's typically not so much of an option anymore. I don't know very many companies who are doing that, but that certainly used to be an option. Telehealth, so we call it telemental health. Telehealth is basically doing services online. So it could be video sessions, it could be phone sessions. The one thing that you want to look for when you're thinking about doing a telehealth, finding a provider who does telehealth is, do they have a HIPAA compliant platform? Meaning, do they use things like, so in our practice, we use Simple Practice. So it is completely secure. Zoom has a mental health platform. And so if they have that special platform, Zoom can be totally HIPAA compliant. FaceTime is not HIPAA compliant. So if you have a therapist who's trying to do services on FaceTime, that is not HIPAA compliant and is not a secured, safe way to deliver services. And then there's also walk and talk therapy. So that's kind of the newer thing that's kind of replaced in the office and also in the home. And walk and talk basically is like where you would go to a park and either the therapist and the client can sit on a blanket, play games, So a lot of play therapy with the younger kids. You can walk around, and it's really good, especially for teens who don't get out the house. They, are in bed all the time. So coming to an office and sitting on the couch, not that hard for them. But having to go to a park and walk around, that may be the only exercise they get. They get some sunlight, they get some fresh air, and it's a change of scenery. So walk and talk has been very popular nowadays. I love doing walk and talk with my clients. It changes, depending on the season. Fortunately, in California, we could probably do walk and talk most times of the year. But in other parts of the country, that you may be limited to that. And then there's also service delivery in the hospital. And there's service delivery in the hospital, not just inpatient, IOP services, PHB services, and dual services, and also group are also delivered in a hospital setting. So you might not actually be in the actual inpatient hospital, but they may have a separate building where they deliver services as an outpatient in a hospital. So there's different types of psychotherapy. So sometimes parents ask, like, what do you do? Like, how do I know which method is best for my kids? So there's many different types of psychotherapy, but they kind of fall into 5 major categories. So you have behavioral, and behavior is basically focused on the behavior. What is the behavior that the child is exhibiting, and what are the ways in which we could change that behavior? So it's strictly focused on behavior. Cognitive psychotherapy has to do more with the brain. So the way that we respond to stimulus has to do with what happens, how we interpret it, and then there's a behavior. So in cognitive therapy, we're looking more at how is somebody interpreting the events of their life. And if we can change that interpretation, then that will ultimately change the behavior. And it makes them less vulnerable to the stimulus that happens. And then you also have the humanistic approach, which basically looks at the whole person. How do people attach personal meaning to experiences? And the humanistic, people who practice humanistic therapy really look at the hierarchy of needs. So there's a hierarchy of needs. At the very bottom, people need food, water, and shelter. And so are those basic needs met? Next, people need safety. And in safety, they also talk about employment. So is there a lack of employment, or is it underemployment in the family? And the next hierarchy, love and belonging. People want to feel loved, and they want to feel belonged to. So that includes family, friends, and intimacy. On the next level, people want to feel self-confident and feel worthy. And then at the very top is inner fulfillment. So what therapists do is they look at it and what part of that hierarchy is missing in that person's life. And they start at the bottom and really work towards the top. And so when each of those goals are met, once this hierarchy is completed, then this person can actually have inner fulfillment. But if they don't have the basic needs, if they have no food, if a teen is, homeless and struggling, parents are unemployed, or they have no friends, there's no way they're going to have self-confidence or worth or have, inner fulfillment. So we sort of start at the bottom and work our way up to the top. And then you have the psychoanalytic. And psychoanalytic taps into the unconscious mind. So it's the idea that people have thoughts, feelings, and desires and memories that are unconscious to them. And it sort of shapes the way that they view the world, the way that they walk through the world, and their behaviors. And so psychoanalytics will tap into that part of the brain and bring the unconscious into conscious. And then it enhances the functioning of the person. So they get a better understanding of, oh, you know what, my behavior is related to the fact that when I was a kid, this was something that was a tradition in my family. And so I've just sort of repeated this same cycle in my life, unconscious to me. But now that I know that where this is coming from, I can have better control over my behavior. I can change, I can interrupt that pattern. And then you have the integrative form, which basically just means that therapists use a combination of two or three, or all of the different forms of therapy. So you will see most commonly for teens that therapists use CBT and DBT. So CBT is cognitive behavioral therapy. So you're using the cognitive and the behavioral approach together. DBT is dialectical behavioral therapy, which is a part of CBT. It came out of CBT, but it has more to do with, it focuses a lot more on behaviors and dialectics, where two things that may seem completely opposite can be true at the same time. So with teens, you pretty much see, for the most part, people using CBT and DBT. CBT is very common. In order to practice DBT, you have to have training in it. And so it's a pretty niche form of therapy. But if you have a child who is showing symptoms of borderline personality disorder, DBT was especially made for that. So these are teens who are constantly self-harming, who may be constantly going to the hospital back and forth, who use suicide and self-harm as kind of ways to control their surroundings. DBT is especially made for them, and it's a really good form of therapy. Other forms of therapy, TMS and TBS. So TMS is transcranial magnetic stimulation, and then TBS is theta burst stimulation. And this is kind of a newer form of treatment. And basically what it is, it comes out of electroshock therapy, but it's much less invasive. So basically what it is, it's a magnet that is kind of put over your head. And they've done, doctors have done a bunch of tests to try to target the part of the brain that is causing the depression. And basically they send these theta bursts into that part of the brain to try to stimulate it, to try to help cure depression. The difference between TMS and TBS, TMS is kind of the original form. You would go to a clinic. So these are services that are delivered in a clinic by a physician, and you would go 30 minutes a day for 30 days. And then TBS is a stronger form of it, where you would actually go 3 minutes a day for 20 days. And this is 20 days straight. And the reason why I bring this up is that this is actually FDA approved for adults between the age of 18 and 70. And this is mainly for the super depressed that have not been responsive to medication or any other forms of therapy. It's kind of like a last ditch effort to try to help. The last time I went to a seminar on it at Stanford, they gave numbers about it being about 50% successful. And that's not because it doesn't work, but it's because it's really hard to figure out which part of the brain is that part that's non-functioning for the depression. And that was pre-COVID. So my guess is things have gotten better since then. It is considered off-label, or it's not FDA approved for teens. Now, there are a lot of medications and treatments that are considered off-label that are being delivered for teens. I do know that Stanford was doing trials of this for teenagers, but I want you guys to know that this should be delivered by a physician. I have heard of parents being able to get these sort of machines from other countries and putting them on their kids. I would caution against that because these are very, you do this under very serious situations. Yes, they may work, but again, they are not FDA approved for teens as of yet. If you are interested in that, you can look up clinical trials at Stanford and possibly also UCSF. And I did put about clinical trials. There are always clinical trials going on with or without medication for other forms of treatment, either therapeutic forms or medication that are going on for teens and teens, young adults, and even kids. So UCSF and Stanford are probably the big ones that do these clinical trials. There's another form of treatment called a life coach. And people ask all the time, you know, should I get a life coach? A life coach is a wellness professional who is supposed to help with a particular goal. I do want you to know that wellness coaches are not licensed professional. You do not need a degree or formal training to be a life coach. There is no state mandating or regulations on a life coach at all. Do I think a life coach could work? I have met a life coach and have worked in conjunction with a life coach with a patient before that I thought was a great life coach. I also know people who just decide, hey, I've had a hard life, so I'm going to be a life coach and help somebody. And, you know, doesn't mean that they can't be successful and can't help the person, but again, does not take the place of a clinical licensed professional that is there to treat things like mood disorders and personality disorders. Okay. Okay. So where do I start? Let's start with who treats mental health illnesses. First, you have your psychiatrists and your nurse practitioners. So a psychiatrist is a medical doctor. They've gone to med school, and they are doctors that do medication management. They can prescribe medications. There are some psychiatrists who are also therapists, and so they do both. There's debate in the world of whether or not a psychiatrist should also be your therapist. But I do know that there are some psychiatrists that also do therapy. Nurse practitioners are not medical doctors, and they typically practice under a psychiatrist or under a medical doctor, but they can also prescribe medication. Then you have your psychologists, your licensed clinical social workers, your licensed marriage and family therapists, and you have your licensed professional clinical counselors. And those in that group does therapy. So psychologists are doctors. They either have a PhD or a PsyD. And typically they actually specialize in some form of therapy. Licensed clinical social workers, in the social work field, you're trained to look at the whole person, not just the person you're treating, but the entire family. So social workers tend to have a much wider view of the entire family situation. A licensed marriage and family therapists have a lot of training on not just working individually with clients, but working with the entire family. So you'll see, like, if you wanted family therapy, that might actually be a really good option. And then you have your licensed professional counselors. Sometimes you see licensed professional counselors in the school district, but they also do private practice work. Then you also have your school counselors. So most schools, probably all schools, have some sort of school counselor, or they've contracted out those services to someone else. Your school counselor may or may not be a licensed professional. So that's something that you want to ask. Your school counselor, most of the time, are pre-licensed clinicians, which does not mean they're not good at all. So pre-licensed clinicians, which are called associate social workers, associate marriage and family therapists, associate professional clinical counselors. They're in the state of California, they actually have to be registered. So one thing you know for sure is that they have been fingerprinted, they have to have a master's degree, and they've had to pass an ethics exam. And what they're doing now is they're gaining their hours to get licensed. It takes a minimum of 2 years to get licensed, 2 years of clinical work to get licensed. And a lot of people take longer than that because you have to get so many hours, but you can't accumulate those hours in under 2 years. And so all pre-licensed have to work under a licensed person. So you would be able to ask if they're pre-licensed, who are you working under? And you could get their information. So you sometimes, I tell parents, you actually kind of get 2 therapists in one. Because they're getting supervision typically once or twice a week. So in our practice, we do work with pre-licensed clinicians under close supervision. Where do I find a good therapist? Psychology Today is probably a really great place to start. Most therapists have a website on Psychology Today. Therapists do have to pay to be on that website. However, the website does a really good job of making sure that person is licensed or pre-licensed. They do their own checks, and therapists are able to update their availability. You will know what insurances that they take. You know, like where their office is. Are they doing telehealth or are they doing it in person? You get to see a picture of them. Sometimes you will also see a video of them. You'll see kind of what form of treatment that they use. It's a really good place to get a lot of information about a therapist. Also, word of mouth. Asking around. So a lot of times parents don't want to tell other people that their child is suffering. That is probably the worst thing you could possibly do, because chances are your neighbor's child is suffering, your friend's child is suffering, your sister's child is suffering, and asking about, hey, have you heard, I'm looking for a therapist for my child. Do you know of any good therapists? And so that's a really good way to get information. Your school counselor. So school counselors are limited in the amount of therapy that they can actually give to your child. So they will have referrals on where else to send them. A lot of schools have other services. The school district near here in the Bay Area, Cassie, is a pretty big kind of outsourced therapy center that students are referred to. But if you need like even more counseling than that, they will typically have resources to help you. Your pediatrician is also a really good resource. Pediatricians, they typically, anytime your child comes in for a physical, that's part of the information they ask. They ask about suicide and self-harm, and they should have some resources for you, both in network and out of network, and I'll tell you a little bit more about that. But pediatrician is a really good place to start. Also, your insurance company. Your insurance company has an obligation to provide you a list of in-network providers for mental health. So you would call the number on the back of your card and ask them to send you a list of in-network providers. Now, the challenge with that may be is they may send you a list. You may call everybody on that list and get no phone calls back. That is very common. And I'll talk a little bit more about why that is. But your insurance company should give you a list of providers. So talking more about consent. Can my child get therapy without me knowing? The answer is yes. In California, a child 12 years and up can consent to their own treatment without a parent knowing. Now, that being said, typically the only place where that happens is in schools, because schools won't bill your insurance. An outpatient therapist who's going to either be private pay or you have to bill your insurance, they're going to have to involve you in it, because you can't bill your insurance or ask you to pay if you don't know anything about it. However, but in California, teens or children 12 and up can consent to their own therapy. As I mentioned, every therapist is a mandated reporter. So anytime a teen reports something about abuse, either has happened recently or in the past, and they have a reasonable suspicion of child abuse, they have to report it. And that doesn't necessarily mean that they think you're a bad parent or that they think you're abusive. It's just that your child has said one of the target words and they have to report it or they can go to jail. And when we do call CPS, we tell them, hey, you know, the child says this. I don't necessarily think that the parent is abusive, but as part of my mandating responsibilities, I have to report it. CPS may or may not take the report. They may or may not come out. The therapist does not have an obligation to tell you that they made the report, but it is kind of common within the community to tell parents up front, hey, I have to make this report just in case, you know, CPS does show up at your house, and that can be a traumatic event. But that doesn't mean that the therapist is bad. Sometimes parents get very dysregulated and they just want to pull their kid out of therapy, and really taking a moment to kind of understand that even if the child is lying, that therapist may know that the child is lying, but that doesn't mean that they don't still have to report it. And so communication about that is key. I mentioned before about a 5150 or 5585. Most of you probably heard of a 5150. Basically, a 5150 is a hold that a clinician can put your child on or an adult on if they are a danger to themselves, a danger to others, or gravely disabled. And danger to themselves means that at that time, they're saying that they want to kill themselves. They're going to kill themselves. They have a plan, or that therapist just feels like, you know what, I don't believe them that they can be safe. And the therapist can put them on a hold and take them to the hospital. Parents ask all the time, if you put my child on a 5150, can I just take them home? And the answer is no. You do not have authority to take your child home once they've been placed on a hold. They have to go through the process. They will go to the hospital for an evaluation. And after that evaluation, the psychiatrist at the hospital will decide if they need to go to a mental hospital or if they could go home. And they will get information from you. But a parent cannot override a 5150. The 5585 is the exact same thing as a 5150, but 5150 is used for adults. 5585 is used for anyone under the age of 18. So if you happen to see those numbers, I just want you to know what that is. In terms of the risk and benefits of therapy. So there are risk and benefits of everything. So the risk of your child going to therapy, they don't bond with their therapist. The form of treatment doesn't work. They end up going through multiple providers, so they never establish trust, and they just hate therapy altogether, which is also always a risk. Benefits of therapy, they're able to create a life worth living. And that is the whole point of going to therapy, is to help that child figure out what makes life worth living for them. We teach teens how to not suffer. And sometimes when you're in your depression, you don't even know that there's a possibility that you don't have to suffer. And so teaching the teen that you don't have to suffer, you're not alone, being able to provide validation where other places aren't. So maybe they're not getting validation at home, not because, there's bad parenting or anything like that, but like everybody doesn't know what validation is. They're not getting the world in and of itself is not a validating place, but in therapy, they can get that validation. And you also get psychoeducation for the parent. And that's what's key for therapy for teens, is being able to include the parent and give the parent education on what's going on with their teen. If they have a diagnosis, what does that mean? How do I help my child? Where you wouldn't get it in any other place from a licensed professional. In terms of confidentiality and privacy. So most of us know what HIPAA is. And HIPAA is a federal law that protects against third parties being able to get information about your mental health. So your job is not supposed to get information about your mental health. The school is not supposed to get information about your mental health unless you sign a form. Other people who are not, just random people should not have access to your mental health. So HIPAA is a federal law that all therapists are mandated by to keep records confidential. And that goes to making sure if you're doing telehealth that you are on a HIPAA compliant site that people can't hack into and see. That if you're doing paper records, that you're keeping things locked up, and there are laws, it has to be kept locked in three different locks, like 3 different spaces where things are locked up. And so HIPAA, there are serious federal penalties for violating HIPAA, both in a hospital setting and in a private practice setting. In terms of privacy and teens, so it is really important that teens feel safe when they're in therapy. If they think that they're coming to therapy because their parents are nosy and just want to know everything that's going on with them, they're not going to tell their therapist anything. So the therapist really walks a fine line with keeping things private, keeping things confidential with that teen so that they can get as much information as they can and be able to help them and that teen feels safe. If your teen is doing telehealth, making sure that your teen is in a place where they are alone. If they're in their room, they need to be alone in their room with earbuds on, with a sound machine, so they don't think that their parents are spying on them. If they do, they're not going to open up, and it's really just going to be a waste of time. There are things that therapists have to disclose to you. So if your teen says they're going to kill themselves, or if they are self-harming, if there's imminent risk, that therapist is mandated to tell you to help keep them safe. But certain things, teens experiment with drugs, teens experiment with sex. If they're being safe, those are likely things that a therapist is not going to tell you about. Now, if you're talking about a 10-year-old having sex and doing drugs, that might be something different. But a 17-year-old who's experimenting with these things may not be something that's disclosed to parents. And that's just because of privacy. And we know sort of what's the normal behavior for teens, what is abnormal. If a teen is, we're looking at like things like bipolar. If a teen is having sex with multiple partners during certain times, when they're having manic moments, that is something different. And so we have to be able to determine that and make that judgment call. There's also forensic therapy, forensic social work. And usually that happens when there's a divorce or a custody issue or when there's abuse allegations. So forensic therapists basically come in and they interview your child. And they interview your child for a specific reason, either likely to testify in court. I caution parents about doing forensic interviews with the exception of abuse. But in divorce and custody issues, because anything that child says to that therapist gets put in court records, and it completely destroys what the teen thinks therapy is. They think, oh my gosh, anything I say to a therapist from now on is always going to be shared with my parents. And they don't trust therapy at all. There are certainly situations where if there is an abuse situation, there are forensic social workers, forensic psychologists who are trained to get that information out of that child in order to be able to prosecute that abusive person. But when we're talking about divorce and custody, if you're really trying to get your child therapy to help them through the process, then thinking about whether or not you are going to want that therapist to testify in court. There are a lot of therapists who will make you sign that you will not have them testify in court because that's not their specialty. It is a specialty. Forensic therapists charge a lot more than a regular therapist to do that work. But I do caution parents, if your motive is to get your child help, asking the therapist to testify in court, mandating them, having your lawyer call them into court will definitely destroy what your teen thinks of therapy in the future, and they may not get help later on when they really need it. Okay. So let's talk about insurance. So when you look at your insurance, and for this purpose right now, I'm going to talk about private insurance. I'm not going to talk about Medi-Cal at the moment. And so for private insurance, typically most insurance have what's called a mental health benefit carve-out. So you may have United Healthcare, but your mental health services are actually through United Behavioral Health. Some insurances, you know, like Cigna, also manages their mental health. But most insurances have a different company that manages their mental health. How do you know that? On the back of your insurance card, you will see a number. It'll say employee number, and then you'll see a mental health number, and it will be a different number. And that means that there is a carve out. So what the questions, where you would want to go to find out what your mental health benefit is that person or that group who's managing your mental health benefits. There is in-network providers and there's out-of-network providers. In-network providers means that that group or that provider is contracted with your insurance to provide services. They have a contract, they have a set rate that the insurance is going to pay for that service. Then you have out-of-network providers. They are not contracted with your insurance. They charge whatever rates that they want to. And then if you have out-of-network benefits, you can bill your insurance on the back end for reimbursement. How do you know if you have in-network or out-of-network benefits? If you have an HMO and an EPO, you likely have, there's an in-network. And you unlikely, especially if you have an HMO, you unlikely have out-of-network benefits. But you would need to call to find out. If you have a PPO, then you likely have both in-network and out-of-network benefits. And they're different. So where an in-network, if you use an in-network provider, you may pay one price. If you use an out-of-network provider, you may pay a higher price for the same service. But if you have an HMO, they may cover nothing if you use an out-of-network provider. That is something that you are going to want to ask your mental health provider, your mental health provider plan. And so I'm going to go over kind of what the explanation of benefits means. Whenever you have services, like if you have like any sort of medical services, you usually get mailed or emailed what's called an EOB, which is an explanation of benefits. So I'm going to explain in terms of mental health what explanation of benefits would be. So the amount that you would pay for therapeutic services for therapy is basically your deductible plus your co-insurance and your copay. So your deductible is typically the amount of money that you have to pay before any of your benefits kick in. Your deductible may be, you may have a separate deductible for medical and a different deductible for mental health, or they may be the same. Deductibles range anywhere from $50 all the way up to $3,000. So some people have high deductible plans. So that $3,000 would be more like a high deductible plan. Your co-insurance is the amount, the percentage that you have to pay for that service. So a lot of plans will pay, hey, you know what? We will pay 80% of the covered of the service. So your co-insurance is that 20%. So you're paying your deductible. So say your deductible is $250 and you haven't met your deductible yet. So you're paying $250 plus you're paying the 20% for whatever service. Say the therapy is $100. So you're gonna pay $20 plus a copay. So copays you're probably familiar with. If you go to the doctor, usually you may have a $10 or $25 or $50 copay. Most of the time for mental health services, you don't have a copay. You typically will just have a deductible and a coinsurance, but for some plans, you also have a copay. And you want to make sure, because your medical copay may be different than your mental health copay. You may have a $25 medical copay, but no copay for your mental health. You would have to find out. So the total amount that you would pay would be your deductible plus your coinsurance plus your copay. And please remember, you pay your deductible once per year. So after you paid your deductible, the next time you have a session, then you would only be paying your coinsurance and your copay. And you pay this up until your maximum out-of-pocket. Sometimes you'll see it as OOP max. So your maximum out-of-pocket is the maximum amount of money that you will have to pay for your mental health treatment for that year. And that may be different for in-network versus out-of-network. I have seen where your maximum out-of-pocket for in-network services is $1,000, and your maximum out-of-pocket, if you use out-of-network services, is $10,000. So I've seen a huge discrepancy like that. You have to really find out from your insurance company what it is. But once you've met your maximum out-of-pocket max, anything that you have will be covered for free for the year. So remember, all of this is per calendar year, okay? So what are some other ways to pay for it? Say I have tried to do it in network provider. I have not been successful with somebody who is bonded with my child. I don't have out-of-network coverage, or I have some out-of-network coverage, but the amount that I have to pay up front for therapy, I can't afford. There are other options to pay for therapy. One is an employee assistance program, or EAP. Most employers have an employee assistance program. If you've ever seen Lyra, Modern Health, or Concern, if you ever heard those within your employer, those are employee assistance programs. Those are probably the most common ones. Lyra and Modern Health are mainly in the tech community, Concern more in the health industry. Sometimes these employee assistance programs have a maximum number of sessions per occurrence. So depending on what your company has purchased for you, they may say, okay, you can have 5 free sessions, but you'd have to use one of their, so it becomes an in-network. So Lyra, Modern Health, and Concern have their own network of providers. So you have to use one of their providers, but it's for free. So you don't use your insurance at all. You use the employee assistance program, and that's covered for free. So when they say you have a maximum number per occurrence, so, okay, you know what? My child is having depression. So I get 10 free sessions. Use up the 10 free sessions. Well, you know what? My child is also now having some anxiety. Okay, we'll go back and reauthorize for another 10 sessions. And so that's just sort of a way to get the most out of an employee assistance program. I do know that Lyra and Modern Health are very good in that they pay their providers the rate that they would accept as an out-of-network provider. So you're more likely to find a therapist using those. Concern, not so much. They don't pay as much to their provider, but it really depends on what the company has contracted them with. Another option is what's called a health savings account or a flex spending account. So a health savings account or a flex spending account is money that you put into an account every pay period to pay for health services. I'm not sure, and there's usually a maximum that you can put in. So it is your own money, but it's taken out of your paycheck every 2 weeks or whenever you get paid, and it's put in a separate fund. And when you need to use it, sometimes you'll get a card that you can use to pay for it. Sometimes you don't get a card and you just have to submit reimbursement. Mainly people think about this for medical reasons, like for co-pays to the doctor. During COVID, this was extended to like over-the-counter medicines you can use for it. If you have kids who are like toddlers who are still wetting the bed and you need like special diapers for them, that's included. Not regular diapers for baby, but special like training pants are included. Medications are included, but also mental health services, and people don't always know that. So you can use flex spending account to pay for therapy services. There is a maximum amount that you can put in, and that's set by the federal government. I believe last year it was $5,000, but it does help. And so in order to use it for mental health, all you would have to do is get a prescription from your primary care doctor that says, hey, you know, this child needs therapy. You submit it with the bills that you've gotten from the therapist, and then you can get reimbursed. I mean, it is your money, but you get reimbursed. The one thing about especially flex spending accounts is that you either use it or you lose it. So you elect the amount that you want during open enrollment, and then you have the year to spend it. They did during last year during COVID, they extended it. So there's a certain amount of money that can roll over into the next year. But I would tell you that when open enrollment comes up, that you want to ask your benefits administrator specifically how it works and what you can spend that money on. There are also victims witness programs. If your child or you or a victim or a witness to a crime that has been reported to the police has a victims witness fund that can help, that will pay for therapy, they pay for relocation services, all of that. So you would have to go into the police station, whatever police officer is working on the case, and ask to get connected to Victims Witness Program. I have seen Victims Witness Program pay for IOP services, for residential services. Typically they pay it on the back end in terms of getting reimbursed, but they do have money and that's what it's there for. But you have to ask in order to access it. Then we have the Every Student Succeeds Act, which replaced the No Child Left Behind Act. And basically what that says is that all children must be provided with the services that they need to be successful at school. So what does this mean for parents? If your child needs to go to a therapeutic boarding school or a wilderness program, it is the responsibility of that school to pay for it. It may take a lot and it's easier said than done, but having an IEP for your child, getting an advocate to help you, but there are certainly situations in which that child, the only way that child can actually get the school services that they need is through a residential or a therapeutic boarding school or through a wilderness program, and the school district would be responsible for paying for that. And so especially things like therapeutic boarding schools, your insurance would not pay for that because they would tell you that that is a school's responsibility in order to provide those services. That is a very difficult and tedious process to go through, but well worth it if you are able to get that. I tell parents to get an educational advocate to help them with that process. I told you that I would talk to you about why so many clinicians do not bill insurance. So most insurance companies, most clinicians charge anywhere between $175 to $250 for therapy. And those are 50 to 60-minute sessions. Most insurances may pay anywhere between $75 and $80 for a session. So what does that mean for the clinician? In order to make ends meet, that clinician would have to see double the amount of clients in order to make it worth it to accept that insurance. And it also makes it so that they can't specialize in certain, they can't be a specialist because they just have to take everybody who comes in. And most therapists really they have a niche. They have a certain population that they want to work with. So they choose not to bill insurance. And so what happens is they can check to see if you have out-of-network benefits. They can send you a super bill, and it's called a super bill, where they can give to you so you can submit it to your insurance if you have out-of-network benefits. Even if you don't have out-of-network benefits, if you find a therapist that your child clicks with, the benefit to paying out of pocket for as much as you can is astronomical, and it's totally worth it. I'm biased because I am a therapist, but therapy does work. So that is why maybe if you get a list from your insurance company and they say that, you call the list and nobody responds, they're probably like, either I have enough of these, I have enough of insurance clients, I can't take anymore, or they've just decided not to do it anymore. Also, insurance companies take 30 to 60 days sometimes to actually pay the therapist. So it can be very, very challenging. Okay. And I know that we are over time, but I want to end with kind of things to consider when deciding therapy. Motivation. Is your child motivated for therapy? Did your child walk into your room and say, I want therapy? You want to jump on that right away, because motivation fluctuates from day to day with your teens, as you already know. If they're motivated, that is something you want to jump on right away. Please remember the stigma. It is very hard for a teen to say, I want therapy, because there's a huge stigma within mental health that something is wrong with me. And part of going to therapy and part of the therapist's job is to help strike down that stigma. And part of what you can do is say, okay, great. I'm so proud of you for reaching out and wanting to get help. And then time. How much time can you devote to this? How can you rearrange your schedule in order to make this work? Because it's really important. I tell parents, you never know what level of care your child is at, because they may not tell you that they're suicidal. They may not tell you they've had a suicide attempt, but those are things that they might tell a therapist. And time is of the essence. If I get a lot of parents who say, oh, they can't do therapy because they don't have enough time, they got to do schoolwork, or there's other things they need to do. And I tell parents very bluntly, if your child is dead, there is nothing else that's going to matter. So really take the time to listen to them and do the work to try to find them a match. Level of care. Thinking about what the right level of care is. You may not know, if you're not a professional, you won't know what the level of care is. You start one place, and that therapist should be able to guide you and help you figure out what the right level of care is. If you live in the Mountain View, San Jose, Los Gatos area, El Camino Hospital does free assessments for IOP program, but you can also get an assessment to see, does my child need IOP level of care or higher, or do they need a lower level of care? That is a resource that's available to you. And most hospitals we'll do a free assessment. It may take a while to get an assessment, but it's certainly worth it. And also trusting the process. Sometimes we are as parents, and I'm a parent too, we want to sort of control everything. We want to know everything that's going on. And sometimes we have to let go and trust the process. Trust that this professional knows what they're doing, especially if their child is bonding with them. Trusting that, okay, I'm going to let go and I'm going to, hope that, and I'm going to watch for signs. Is my child getting better? Are they more happy? Are they doing things that they weren't doing before? Are they using skills? Communicate with the therapist. Hey, how's my child doing? They may not tell you exactly what they're saying, but therapists should be more than welcome to send you an email and an update on what's going on with your child. Okay? So that's kind of it. Don't give up. You may run into a lot of roadblocks, a lot of barriers into trying to find a therapist, but don't give up. Each mind matters. All your kids' mind matters. And so therapy can help. So that's kind of the end of my presentation. I am going to check to see if there are any comments or any questions. Please let me know if you have any questions. I don't see any as of now, but if you do have questions, please feel free to email me, call me, send us a message. 1 second. Okay. Email me, call me, send us a message. We are at www.jacobsladdertherapies.com. We are available to take on new clients. I would like to thank all of you who joined us today. If you missed any part of this or want a recap, please, you can view it in our Jacob's Ladder Therapies Facebook or YouTube channel, and the links have been posted. I will repost them again. If you feel your family member or you could benefit from therapeutic services, please call us. We provide free assessments to help determine the right level of care, even if it's not with us. And yes, we are accepting new clients for both in-person, video, and walk and talk sessions. And I have already put the self-schedule in the comment section. And you can view all of our clinicians on our website. Again, at www.jacobsladdertherapies.com. And thank you again. And to all of you, please be safe, be well, and good night.